Hello, everyone. We are here to go over the most common study you will read on your pediatric rotation, and that is a X-ray chest abdomen, which is combined as the babies are so small you usually can just take the one image. So, just getting right into it, the first thing you want to do is start with the lines and tubes. So, first, just starting, we can't see if it is a OG or NG tube, but we see an enteric tube coming down the midline passing the diaphragm and into the stomach here and next. What you'll see a lot of in these patients, especially with premature patients, is what they call an umbilical vein catheter. And that's this line here. An umbilical vein catheter is commonly used as it can be difficult to be placing typical PICC lines, as you'll see in an adult. They are able to be placed in babies, as they will go through the umbilical vein into the portal system and through the ductus venosus before it closes and be able to enter systemic circulation. You want to see it go straight up. You want to see it bypass past the portal system and either be at or slightly above the diaphragm is adequate position to be in the systemic circulation. After you've gone over the lines and tubes, you don't see an endotracheal tube, at least in this image here. We want to assess the lungs on this patient. So, looking at the lungs here, especially with premature patients, it is very common to have bilateral, hazy opacities, as we can see diffusely throughout here, which is consistent with RDS. We want to make sure you're checking for any pneumothoraxes and any pleural effusions. And then also, we want to look at the cardiac silhouette. It seems to appear normal in size here. And then moving on to the abdomen, we want to make sure we see gas. A lot of the times these babies will be crying. They'll be on CPAP, all things that can cause a little bit more gas to be in their stomachs. Like this may be upper limit of normal, but still normally see gas throughout. You don't see signs of bowel obstruction anywhere. The other two main things to look out for are signs of pneumatosis and portal venous gas, especially if they have a UVC. We don't see any here, which is good. And lastly, we want to make sure we check the bony structures. And with pediatric patients and newborns, obviously look at all the bones. But the three main ones to look out for are injuries to their clavicle, making sure they have 12 sets of ribs, and also making sure that they have normal vertebra and that we don't see any butterfly vertebra. So overall with this, most likely, premature baby, we see signs of RDS with diffuse bilateral haze opacities, and otherwise the rest of the X-ray is unremarkable. Thanks for watching this video. Please like and subscribe so we can continue to make more of these and continue to improve ourselves and make it most beneficial to medical students, incoming residents, and current residents just looking to touch up on anything they may have not seen in a long time.